Well, the situation, of course, when it started, I think worldwide we saw rapid uh, rates of infection. Similarly, I think in Australia, the federal government, together with the states and territories, have responded through a series of measures, effective measures, particularly in containing the spread of COVID-19. Of course, they had a series of measures of lockdowns, particularly at the through mechanisms of through an interagency coordination mechanism, which is called the Australian Health Protection Committee, and this is comprising health experts together with the cabinet ministers, relevant high-level ranking officers in dealing with this particular situation. They were also able to pass certain decrees, laws, to enable the law enforcement aspect of dealing with the situation. And of course, in containing the virus, of course, since we do not have the vaccines as yet, we still have to contain the spread through various measures, travel restrictions being one of the priorities for Australia, particularly interstate travel, traveling between territories, limiting movement as much as possible, going down as to, in terms of, particularly in ACT, the Australian Capital Territory, limiting to work from home methods, decreasing mobility, whether to go outside of your homes, of your accommodation places, only for essential services, meaning to purchase food, to purchase medicine, to see the doctor. In terms of international travel, we have been seeing a complete sort of ban against foreign travel. And this is particularly since around the 20th of March, there has been ban against incoming foreign travelers. Those who can travel to Australia would be Australian nationals, citizens, and of course, foreign travelers can go outside of Australia, but for those inbound would be restricted to very minimum categories of those who can come in.
Ambassador, and what about Thai who live in Australia? How many of them have told you that they like to return to home country like Thailand, and how have you managed to help them?
In Thailand and Australia, as I mentioned about the bans on air travel, so there is limited or very few commercial flights traveling between Australia and Thailand. The direct flights, particularly Thai Airways or Qantas, which have been flying from different cities in Australia to Thailand, a significant more than 10 flights per week were cancelled or reduced. The last Thai Airways flight, the Qantas flight, which was seen to be the last flight in March, was flown on the 26th and 27th of March. At that time, there was still a backlog of travelers, especially Thais who had booked on various flights wanting to return home, but because of various measures also on our part for incoming travelers, where they have to find documentation, fit-to-fly documents or certificate documents from the embassies to certify their traveling to Thailand. This also created some problems for remaining Thais in Australia. What the embassy had started to do together with the Team Thailand based in Canberra and the Royal Thai Consulate in Sydney, we had worked together in making recommendations to the Ministry of Foreign Affairs and in discussion with Thai Airways to work with the COVID Situation Center in Bangkok to authorize a special commercial chartered flight for Thais who wish to return to Thailand. As I mentioned, the commercial flights that were cancelled before, those tickets were not refundable, not refundable to use on this special flight. All the flights were cancelled. So this special flight had to be arranged based on the guidance, the procedures issued by the CAAT on the Thai side, as well as bearing in mind the Australian restrictions of travelers between states and territories as well. So we also worked with the Australian Embassy in Bangkok because we know that if we organize a chartered flight, the cost would be very high, and this I think would not be affordable for Thais or any passengers. So in discussions with the Australian Embassy in Bangkok, we were able to have also send back the Australians from Thailand to Bangkok in the amount of around almost 200, and we were also able to repatriate 207 Thais on the 26th of April from Sydney, and that was our successful first repatriation flight. At the moment, we're looking at the second opportunity to organize a second flight within this month, and we're working on those details, and it will be likely departing and arriving in Melbourne as the next destination.
Ambassador, how do Thais in general in Australia cope with life under lockdown? And have there been any reports of Thais infection? I mean, infections among Thai people in Australia?
The Thais, of course, have been respecting the guidelines that have been issued by local authorities. We have encouraged them, disseminated information to them of what to do in order to take care of themselves, hygienic procedures, and of course, looking care after themselves. There are about 100,000 Thais in Australia, mostly populated in New South Wales, where you see over 40,000 Thais living there. And then the subsequent states are in Victoria and in Queensland, and of course in the 20-30,000 range. There's also a significant number of Thai students studying here, around 20,000 or so, and we have also been reaching out to them through the Education Counselor's Office in making sure that the students are okay. And the Thais communities, they're here based on various types of visas. Some are tourists, some are on temporary workers on short stay visas, some are students, some are on work holiday visas. So there's this wide range of people. Some have been affected, and we have been reaching out to them through giving out care packages to all Thais all over Australia as a minimum and basic needs requirement. Other than that, we've been keeping in touch with them through the various associations, the honorary consul generals and the consuls general based in the various cities to make sure that they are well and at least safe and healthy. No Thais have been reported to us as being infected, but we continue to give advice and keep a close watch through monitoring and communication means.
And what's the situation in Australia, especially in the past few weeks? Has it been better? Because right now the government seems considering the ease of the restriction. And how is the public sentiment in putting pressure on Australian government to ease the lockdown?
Yes. As I mentioned, the Australian government, both at the federal level and the states and territories level, have worked closely through the National Cabinet. They have issued, I think, effective but stringent measures in keeping containing the spread of the virus. And I think they have been successful because you see, during the past few weeks, the growth in infection have risen, but at very, very low rates. You see a minimum, single digits to double digits. Today, the case is only around 6,824 cases, and 96 deaths since the start of the virus spread. There has been 5,817 cases that have been recovered. And of course, most affected groups have been in the age groups, and of course, in the households, there have been also different types of protections. The situation here, because of the anxiousness, I think, of the different parts of society, basically balancing between the containment of the spread, which is vital, I think, to the long-term recovery of any country. And in this, the health, I think, response has been effective. So now the economic response has to be in place. That is why I think there is a degree of anxiousness, people wanting to go out, wanting to resume their lives, normal lives, going to work, having their families, being able to spend their time outside the houses. But a major part of that is also the economy is, of course, a major priority in trying to deal. So the economic stimulus package, which the Australian government has introduced over 214 billion Australian dollars in various sectors, economic stimulus, short-term measures, financial incentives, tax incentives. I think these is coming together, and there are also giveaways of compensation to the workers, and these types of categories of help are being in place. So as I mentioned that is because you do see a degree of anxiousness to get the economic in place, but I don't think any government would want to risk of opening up the economy at the same time at the expense of going back to square one, where you would see a high growth of infection coming back into place. I don't think that is something. So there is a balance of the procedures that they're following. There are about 15 conditions that the National Cabinet is looking at in Australia of wanting to ease these restrictions. One part of it is, a major part of it is also about schools. Opening schools or closing schools has been a major debate here, but they have also exercised restraint in encouraging the students to go to school. But a large part because the caretakers, particular persons on the front line, health experts do need to bring the students to schools. At the same time, this easing of restrictions, you will see an opening up of, I think, step by step of gatherings, certainly not in large numbers, but perhaps at the moment restaurants have been completely closed, only takeaways, deliveries are allowed, and that also constitutes a large part of the economic activity in Australia and the different major parts of the country. So tourism, I think like Thailand, international hospitality has been hit. So that is why I think this is one part where you will see a revival of the activities that will gradually bring the economic activities back to place. But as I mentioned, not at the expense of the spread of the virus.
So how is life for you as diplomat in the past 2 months? I am sure you must have been missing out a lot of face-to-face meetings and social functions, right?
Yes. Well, luckily, during the past, I arrived at the end of February. During the first half of March, I was able to call on senior officials and the diplomatic corps fully for 2 weeks until there was a lockdown, not allowing for more than 2 persons going outdoors or in meeting places. So it has been done. Meetings, for example, amongst the ASEAN community has been through the WebEx or Zoom means, discussions with the Department of Foreign Affairs and Trade in Australia and the different communities has been done through either social media applications or through digital technology. Face-to-face meetings, of course, has been reduced significantly, but that should not stop us from continuing our work. And in this part, the Department of Foreign Affairs and Trade has been very supportive of our work, especially the diplomatic corps, in providing all the details, what is going on at federal level policies, what we need to be aware of in terms of traveling restrictions. And a major part, they have been very supportive, particularly in the arrangement of this special flight that I mentioned with the repatriated Thais to Thailand. We had to inform them in advance of how many times would be coming from the different states, so as to allow them special permission to be traveling to New South Wales, catch that flight out to Bangkok. So I think work-wise, without the physical, face-to-face connections and discussions, work has been going on as normal as we can. But this is the new normal, and we have to live, we have to adjust and make use of digital technology, I think, for some time to come.
Okay. Thank you very much indeed, Ambassador Busadee Santipitaks, for joining us. Thank you very much.
Thank you.
Stay safe.
Thank you very much, Kun Nathan. Thank you very much, Kun Tepachai. Thank you for having me on your program.
ค่ะ
สวัสดีค่ะ
Thank you.
ค่ะ สวัสดีค่ะ